Diabetic eye disease refers to a group of eye problems that can occur as a result of diabetes. Without diagnosis and treatment, diabetic eye disease can cause severe vision loss or even blindness. Diabetic retinopathy is the most common diabetic eye disease and is a leading cause of blindness in persons with diabetes. It is caused by changes in the blood vessels of the retina. The retina is the light-sensitive tissue at the back of the eye. A healthy retina is necessary for good vision. In some people with diabetic retinopathy, blood vessels of the retina may swell and leak fluid or blood. In other people with diabetes, abnormal new blood vessels grow on the surface of the retina. At first, diabetic retinopathy may not cause any changes in vision, but over time, diabetic retinopathy can get worse. At first, a person might see spots floating in their vision, or may notice a general blurring of vision. Eventually, diabetic retinopathy may cause vision loss and even blindness.
The development of diabetic nephropathy involves hypertension and hyperglycemia-induced changes in multiple pathways that contribute to morphological changes in the kidneys. The glomerulus is a globular-shaped structure composed of capillaries that are actively involved in the filtration of fluid from the blood to form urine. With diabetic nephropathy, early glomerular hemodynamic changes include hyperfiltration and hyperperfusion, which result in microalbuminuria. Increased afferent arteriole dilation due to a dysfunction in the vasoconstrictive autoregulatory response contributes to increased intraglomerular pressure, which is associated with greater mesangial cell matrix production. Expansion of the mesangial area, an early morphological change with diabetic nephropathy, is caused by greater extracellular matrix deposition and mesangial cell hypertrophy. This expansion is associated with a decreased glomerular filtration rate and a reduction in the surface area for filtration, which marks the beginning of renal failure. As this process continues, the glomerular basement membrane thickens, and this may eventually lead to glomerulosclerosis. All of these changes in glomerular hemodynamics cause stress and strain on the kidneys, which, if left untreated, may result in renal failure.
These both diseases are severe complications of diabetes. These conditions pose significant risk to patients, often leading to irreversible damage if not detected and treated early. So that is where usage of AI and machine learning comes into place. So AI models helps in tailoring treatment plans based on individual risk factors. In rural regions where medical professionals might be scarce, these models provide critical diagnostic support. For example, by inputting data like blood pressure, glucose level, and other key health indicators, our AI system can diagnose kidney issues and generate reports that the nurses or healthcare workers can use. This ensures that the patient receives timely care, even in the absence of a specialist. And to tackle this problem, we have embarked and made AI models. For diabetic retinopathy, a model was developed using a dataset from Kaggle, focusing on imaging data. We employ TensorFlow and CNN models providing an accurate diagnosis that can be used in both clinical settings and remote areas. For kidney diseases, the model relies on patient data, including ID, age, blood pressure, specific gravity, glucose, blood urea, and etc. This comprehensive dataset allows the AI to assess kidney function and predict the likelihood of nephropathy. These models represent a significant step forward in the fight against diabetes-related complications, ensuring that more people receive the care they need and when they need it the most. With this, we come to the end of our presentation. Now, before I end it, I just want to give you a quick guide how to view our project. First, at DevPost, please head to our GitHub repo, where you'll find an in-detail project README. You'll find where to access which file, the usage instructions, the library used, and some additional information. Now, if you specifically have to see how the models were trained, which is pretty vital, you can again head to DevPost and see our collab files. These files will help you to where our models were trained. This is the diabetic retinopathy one, where you will find how we collected the data, we used image enhancing on it, and how we use gradient mapping and heat maps to predict whether a person has diabetic retinopathy or not, which provide to be more than 90% accurate. Now, if you'll see a kidney disease one, this is where you'll see how the database was collected, how we cleared it up, and we compared it to a large number of people from ranging from 5,000 entries, and we then predicted the kidney diseases with an accuracy of 96%. With this remark, I, Meherdeep Singh, end this project.